young legs coming into the system repeatedly, handing it over to them. We cannot keep running with the baton ourselves. So that also is a very difficult transition to make in life sometimes. When do you actually let go? When do you stop believing that my time is done and somebody else needs to take over? I think that is the hardest realization, but for people who are able to do that are the ones who really leave a legacy.
And at the same time, letting go doesn't necessarily mean that you completely let go, right? I think that's the other thing. You just figure out what your new role in that setup is going to be. I remember talking about training. We used to have people that were the people that had pioneered these residencies programs and had started all of this, and they were the reasons why they had become so big and so good. And as time passed by, they kind of started taking a step backward, but they never left, but they were always around. There was this guy, Dr. Short, who was one of the first few surgeons that started at Vanderbilt, and he, even at the end of it, was there. He was just running our M&M. Like all the knowledge and everything that he had, he would bring to that meeting and just sit there, run the show, ask questions, and put all of us on the spot. And so there was, even then, or he had just picked one operation. He would do the inguinal hernia, that's the only operation he would do, and he would do it with a knife, no cautery. And that's what in third year, we used to go rotate with Sharp for a month, and all you did was inguinal hernias with a knife with him throughout. So, just little skills that you think you can give to the incoming newer generation. You don't have to completely let go. You can be a part of it. You can keep teaching. You can keep doing a lot of stuff. But setting the stage for the newcomers to kind of come and then take it along with what's happening around in the world is very important, I think. And that's part of what we enjoy as being surgeons. It's doing the operating on our own has been fun. I think we're all over it, and now it's what we can teach the others and let them move forward.
Coming back to your question about the structure training, then I would say that on paper, on documents, किसी भी program में आता है, they are structured.
Yes.
Yeah.
But that Hamdan said कि जो लोग हैं उसको करना are they doing it? And then जो एक third party monitoring है ना, that is all important. Because on paper there is everything.
और एक program भी है, लोग भी आ रहे हैं, probably graduate भी हो रहे हैं, मगर how do we assess कि हाँ जो graduate हो रहे हैं, are they good enough to be out in the public and operating on them or being appropriate doctors to treat the appropriate give them the appropriate treatment. ये कैसे assess करें? ये किस तरीके से assess हो?
I think at the end of the day, बहुत सारे surgeons जो बाहर से भी train हुए हैं, I mean जैसे Zeeshan ने भी बोला, they are doing a very good job. They are being very good surgeons. So I would narrow down your question to the surgical training specifically. I think it is because at the end of the day, how a surgeon operates matters a lot. Education and research, it all goes with the background. That is important. I'm not trying to say that those are not important things. When you're working in a private sector, the biggest edge that you have is the patient volume and the chance that you get to operate. So I think ये एक जगह एक चीज़ है जो जब भी whenever someone wants to join AKU, the biggest question the resident that they have is, will we get a chance to operate? Will we? I mean, if I compare an R1 of our program to an R1 of some program, let's say for example an SIUT or any civil hospital, so there are definitely difference in skills. But वहाँ पे it's like कि आपको छोड़ दिया and you are doing things, and there is no one to monitor. So that can affect patient outcome. So that makes trial and error kind of fun. But when we are doing something, we are being monitored and the patient's outcomes are not affected. So I think वो training program आपको as an individual जो groom करता है ना, वो एक difference आता है. You like if I compare myself to someone who has graduated from some other institute, I will not take the names. But my capability of research, my understanding of the medical education would definitely be far better. That is because where I have worked. But surgical skill wise, I may take longer to learn those things that I have already learned at pretty early stage.
On the contrary, I would say, so we talked about how a first year might have different skills than a first year elsewhere in a busier program or something. But then when you compare a chief of your program to a chief somewhere else, not just the capability of, so surgery is not just the capability of doing the operation.
Yeah,
It's what Hamdan had mentioned, right? Anticipating what the issues can be, understanding what the problems could be, and all of those are gauged by the people you're working around. If I'm working with these guys and they're constantly worried about these things and talking to me about these things, my eventual training when I'm out there is going to be thinking the same things.
well, obviously रेजिडेंसी प्रोग्राम को रेजिडेंट्स मजबूत बनाते हैं.
Yes.
अगर रेजिडेंट्स अगर मजबूत हैं, एक फैकल्टी ज़्यादा से ज़्यादा होनी चाहिए. इट शुड बी अ बिग प्रोग्राम बिकॉज चाहे ना चाहे यू विल लर्न सो मच फ्रॉम एवरी पर्सन दैट यू मीट. हर किसी की कोई ना कोई चीज़ तो होती है. और फिर जितने ज़्यादा रेजिडेंट्स प्रोग्राम में होते हैं उतना ज़्यादा उस प्रोग्राम का हर रेजिडेंट सीख रहा होता है. तो विच इज़ व्हाई पीपल ट्राई टू गो टू बिग यूनिवर्सिटी प्रोग्राम्स. आई थिंक उसमें बड़ी इंपॉर्टेंस है कि द रेजिडेंट्स विच आर बीइंग टेकन इनटू द प्रोग्राम, एक उनकी आपस में बॉन्डिंग, आपस में उनकी लर्निंग, that takes you places.
It's not just the skills also, but the behavior
Absolutely.
of the people that you work with, that is very important. Because many a times अब हमें इसी spot में आता है कि patient है यार थोड़ा ऐसा कुछ उल्टा बारिश है, जल्दी होता है हमारे साथ, kind of regular thing for all of us. But वो फिर आपको flashback आता है that how your consultant used to deal with that. So वो but यही चीज़ अगर आप बाहर चले जाए ना, so difference है behavior.
ठीक है. आहान के अंदर लिमिटेड स्पॉट्स होंगे, 4 लोग आ सकते हैं. सपोजली मेरा नहीं हुआ. हाउ डू आई बिकम बेटर? हाउ डू आई, मुझे पता है कि अच्छा ये अच्छा सेंटर था मगर मेरा नहीं हो सका. अब ऑब्वियसली आई हैव एन ऑप्शन कि मैं दूसरी किसी जगह चले जाऊँ. हाउ डू आई, नॉन स्ट्रक्चर्ड प्रोग्राम भी है, सब कुछ है. हाउ डू आई बिकम बेटर? लाइक व्हाट इज योर टेक ऑन दैट?
The most important thing is individual, man. I think you can be at Aga Khan, you can be at any other institute in the country or in the world. If you don't have the right attitude, you're not going to get there. Right? Hamdan didn't become Hamdan. Saqib didn't become Saqib. Roshan didn't become Roshan just because of Aga Khan. Right? Or just because of the further institutes they went to and trained at. They became these people because they had
Something
a will, an extra push to go above and beyond and get to where they want to go. They have a goal. So I think that matters a lot. So just coming to Aga Khan is not the aim. And there are phenomenal institutes within the country that are producing very good surgically trained people.
I was trying to get at is if you're not at an institute or you have a good mentor, how do you find good mentors? Because कुछ हद तक जो हम लोग सीख रहे थे, इट इज़ अप्रेंटिसशिप. आपको किसी उस्ताद से सीखना ही होता है कि कैसे करना है. उसमें एक तो ये रिलेशनशिप बड़ा ट्रिकी है. मेंटोर मेंटी का रिलेशनशिप जो है इसमें आई थिंक ऑल ऑफ अस नीड टू लर्न एंड रीड अप एंड एक्सपीरियंस आवरसेल्व्स कि यार हाउ डू यू एक्चुअली टेक दैट. लेकिन जो बच्चा बाहर है, he has to find a mentor जो कि you get back to them for every little thing, and you will get to realize how those mentors not affect your just professional life. They also start affecting your personal life, your good decisions to help you advance both the things together. तो जो एक बड़े प्रोग्राम में ना हो उसको चाहिए कि कहीं ना कहीं अटैचमेंट्स करे, कहीं ना कहीं ऐसे लोगों के साथ जुड़े. एक्स्ट्रा टाइम में जैसे गवर्नमेंट सेटअप में अक्सर रेजिडेंट्स ज़्यादा जल्दी फ्री हो जाते हैं, तो भी प्राइवेट सेटअप्स में जाके भी अगर वक्त गुजारने से अच्छे लोगों के साथ, एंड इफ़ यू स्टार्ट गेटिंग टू नो आपको ज़रूर पता चल जाएगा. And then those are people who will actually take you under their wing and make sure that you do well. लेकिन वो effort individual आने
चाहिए. Who is a mentor? Who can be a mentor? I don't know who is a mentor.
That's $1 million question.
वो बात सही है. I can speak from my experience.
How do you seek a mentor? Let's ask that. So you're out there and you want to look for a mentor. I'm an ENT resident and
मैंने तो इसको इस तरह किया था कि जब अंडरग्रेजुएट में आई लुक्ड आफ्टर लाइक कौन सारे बड़े कितने ENT. आई वांटेड टू हेड एंड नेक और करना था, तो मैंने बोला कि जितने बड़े हेड एंड नेक सर्जन जितने उनकी लिस्ट निकाली, सबको लिखना शुरू किया. कहीं बात बनी, कहीं नहीं बनी, मगर कुछ हद तक इतना पता चल गया कि उनकी कैरियर ट्रेजेक्ट्री क्या थी, व्हाट डिड दे डू. तो इवन वर्किंग इन माय साइलो एज एन अंडरग्रेजुएट स्टूडेंट, आई न्यू ऑल द बिग नेम्स कि ये वो लोग हैं जिनके साथ कुछ करने का मौका मिलेगा. मैक्सिमम लोग इसमें एक इंस्टीट्यूट में हैं, तो सबसे पहले तो इस इंस्टीट्यूट में आना है. अगर यहाँ नहीं आता तो मैं क्या करता, पता नहीं
वहाँ आने के लिए क्या करना है,
और वहाँ आने के लिए क्या करना है कि उसकी सारी जो ऑनलाइन रिक्वायरमेंट्स थी पहले से पढ़ना. आई थिंक अब तो मैंने देखा कि MBBS से भी पहले लोग तो स्कूल्स में इतनी ज़्यादा ओरिएंटेड trainings हैं कि people are prepping so much beforehand to be at the spot that they are.
हाँ, ये लोग बदल के आ जाते हैं।
But I think personal research will take you places. You start reading about the best people who are doing that. उनके क्या papers हैं, उनके क्या
अच्छा
research.
मैं I know it's been going on for a very long time, but I think जब हम भी train कर रहे थे हमारे ज़माने में people used to talk about work-life balance, but I don't think so we ever paid much attention to it क्योंकि we were more driven towards हम कुछ सीख लें, काम कर लें, whatever. आजकल do you think people use this as an excuse कि नहीं this is work-life balance and this is it, and people started to say no about it. Do you think there's a balance? Do you think there's an actual balance in surgery?
So it's a good question, and considering today's environment, almost everyone is just talking about it, be it attendings or residents. I think an important aspect which one needs to understand about work-life balance is that it's not an absolute balance, and this balance is basically over a span of one's overall work life rather than just the residency years. So the balance can never be 50-50 throughout the day, every day of the year. It's not like that. So there will be days when work will take precedence over any other thing, and then there will be days when we can have time with family, have our own time, and plus this also depends on what stage of life are we at. So during the initial, my mentor used to say that, one of my mentors used to tell that during the first 10 years of your life, the balance is heavily tilted towards work, because that is the time when you have to spend extra hours to learn and acquire the skills as well as knowledge. So in the first 10 years of your academic or work life, it's heavily tilted towards work. Then as you go into the middle part of the work life, it tends to go between 50-50, somewhat, or 46. And then towards the end part of your career, then it gets tilted towards spending more time with family and getting less involved in work, because that is also the time when we have acquired all the necessary skills, and then there is still learning going on, because for surgeon learning is a lifelong process, but still we have learned most of the aspects, and then that is the time when we have to give back to our friends or to our family and to our students. So work-life balance is basically a balance over this whole span of time, and not just residency years. So my supervisor used to say that you either sweat during residency or you sweat after residency. So it's better to sweat during residency to go through the grind during those 5-6 years, and that benefits us later on.
What do you have to say about this?
I think जब भी वर्क लाइफ बैलेंस की बात होती है, हम लोग उसको बहुत क्वांटिटी में मेजर कर रहे होते हैं कि कितना घंटे काम, कितने घंटे, बट दैट एक्चुअली आई डोंट थिंक दैट इज द वे टू थिंक अबाउट इट. इट्स अ क्वालिटी. काम पे गए हैं तो काम की क्वालिटी अगर उसमें बहुत अच्छी है, भले थोड़ी ड्यूरेशन के लिए हो, घर आने के बाद घर वालों के साथ थोड़ी ड्यूरेशन का टाइम, मगर वो टाइम क्वालिटी का. हम लोग कई दफ़ा ऐसा होता है, एंड इट्स गेटिंग मोर एंड मोर कॉमन नाउ, कि हम लोग आते हैं घर पे भी जो हम लोग अपनी लाइफ के बैलेंस कोड करके करते हैं, 30 minutes is just scrolling through some short reels, और आपको खुद भी फील होता है कि यार मैंने एक्चुअली 30 मिनट्स कुछ भी नहीं किया. तो आई थिंक कंटिन्यूस रिमाइंडर जो है वो इंसान की ज़रूरत है. इट्स अ कंटिन्यूस रिमाइंडर टू योरसेल्फ कि व्हाट इज़ द पर्पस ऑफ द नेक्स्ट हाफ एन आवर, व्हाट इज़ द पर्पस ऑफ द नेक्स्ट वन डे, नेक्स्ट मंथ, नेक्स्ट ईयर, एंड मे बी इन द लॉन्ग रन लाइफ. लेकिन इसके अलावा आई डोंट थिंक क्वांटिटी एवर मैटर्स, कि आपने कितने घंटे जॉब की है, कितने घंटे आपने घर पे गुजारे, तो ये आपका वर्क लाइफ बैलेंस है. ऐसा नहीं होता.
And I think I would add to it that we need to understand the criticality of what we do, right? So that's very important, because जो काम हम कर रहे हैं आप उसको compare नहीं कर सकते with any other thing. It can never be a 9 to 5 work. Okay? So once you get into surgery, you need to understand this thing कि यार ये जो आपका work life balance है ना, when you are in training, it will be tipped more towards work than your personal life. So when you are aspiring to be a surgeon, आपको इस चीज़ की understanding होनी चाहिए. Because I've seen a few residents coming in first year जिनको तो ये मसला होता है कि यार time नहीं दे पा रहे family में. So if you don't have an understanding of these things, and if you are not ready to compromise, I would never suggest those people to become surgeon. Because वो फिर बहुत struggle करते हैं, प्रोग्राम के लिए भी troublesome हो जाते हैं, और अपने लिए भी वो problem create करते हैं. So if you understand those things, तो ये work honestly when I was doing training मेरे ध्यान में कभी work life balance वाला सवाल आया ही नहीं, because जो मैं कर रही थी that was what I wanted to do. So I was happy doing it, तो कभी उसमें नहीं भी सोने को मिलता था. Or when if I was having a good case going on and I was free and I had an opportunity, तो हम जाके इसको कर लेते. So it's surgery is a lot about passion. So if you have the passion of doing it, तो you go through it no matter what. Then थोड़ा सा I think contrast यहाँ पे ये भी है, when we talk about work life balance, यहाँ पे gender बहुत matter करता है, ठीक है. जो struggles एक female surgeons की होती हैं वो male surgeons से बहुत different. So I've seen females leaving the program because they were not able to give time to their kids, especially when they go to the phase of childbearing and those maternity सारी चीजें. So unfortunately, बहुत से residency programs हमारे they don't support females for maternity leave. So in the span of 4 or 6 years, if someone is conceived twice, तो वो प्रोग्राम की तो प्रोग्राम उनको मुसीबत समझने लगता है. That's an unfortunate truth. I mean, I would say probably I was lucky that I focused on training. I did not get married then. उस टाइम पे I focused solely on my work. उस टाइम पे मैं अम्मा पापा भाई बहन भाई सबको इग्नोर किया मैंने. But as soon as I completed, I got married and now I have a baby. And now you are a witness to it that I'm more towards my family life than I of course I'm doing all of my clinical work and I'm there when I'm needed. But एक थोड़ा सा होता है ना 40-60 का रेशियो हो जाता है. And I'm happy with it because you decide कि क्या चीज़ आपके लिए important है. So I think that's how the life goes. It cannot be in measurable terms, and it's work-life balance is something continuous. It's got day-to-day basis पे नहीं चलता.
Zeeshan, आपने जिस प्रोग्राम में you've been trained वहाँ तो there was a work-life balance like in actual way because you were being checked off on post calls जब भी होता है there must be somebody कि भाई आपका time हो गया अब जाए. How did you just go okay हाँ इस काम खत्म हो गया or were you there being in OR because कोई अच्छा case था या like how did
I think the understanding that उधर जरूर कुछ हो गया कोई check कर रहा होगा something of the sort is not true, right? Like at the end of the day they treat you as adults. They've told you कि भाई आपका इतने वर्क रिक्वायरमेंट्स की एक्सपेक्टेशन है, आपने इतने इतना हमसे एक्सपेक्टेड है, इतना आप काम करेंगे. If you're going beyond that or under that, that's completely up to you. At the end of the day, I think with all of them, I'm just going to echo what all of them have said because they've explained it very nicely. Okay, you can't really, it's not measurable. Different phases of life with different चीज़ें important होंगी. Work-life balance is not कि आज का दिन मेरा balance होना चाहिए work और life में, अगला हफ्ता मेरा घर पे और काम पे equal time है. It's like over the next 10 years, I don't want to lose my kids. I don't want to not give time to them at all. By the end of 10 years, they don't even know who their dad is or I'm not spending enough time with them. But I also have to build a career and be successful enough for them to appreciate that too. So the balance comes with time, with years. Like when you're starting a new job, you need to put in that effort. When you're 10 years there, you might not need it, right? So it's like, and then like she had mentioned also, okay, training की expectations फर्क है, consultancy की expectations फर्क है. For the men it's different, for the women it's different. So there should be, I personally say whenever I have students or people that come up to me asking for advice and all, this is an odd question that they at times find also. I ask them, hey, what's your aim in life? Like 10 years from now, 15 years from now, where do you see yourself? Do you see yourself as someone who wants to their home to be priority and work to be the thing that they're going next side, or you want to be someone with a chair of some program and the rest can go along, right? So I think that's how I looked at my life. I wanted to not compromise on my kids, but I really as badly wanted to be a surgeon too. So I divided it into phases. I'm okay, in this phase, my training, I'm not going to think about anything, I'm just working. And which is why in residency I didn't care. Whether I was there all day or night, 3 days in a row, it didn't matter because that is what I wanted to concentrate on. I think the idea of work-life balance, or the reason why this has come forward, is to make sure that work environments had become so toxic, people had become so unhappy that they had stopped enjoying the work they did. And they were poor outcomes because of that. So I think that's the reason why this has now come into being for a while now. We need to balance this out and make sure everyone's getting a break, no one's being used. There's a certain time you can actually learn, beyond which you don't learn. But like you had mentioned, that this can be used the other way around, whether it's used to not work enough. So at the end of the day, it's all on each of us. If you want to work hard, if you want to put in that time to learn and get somewhere, you have to. If you want to use it as an excuse, you can. US में भी कोई structured इस तरह का नहीं था, but ये था कि the reason why these rules are there is that if someone is feeling not good or they feel कि मैं और good, they can always say कि these are the regulations, I need to get out of here. They were not there for everyone to say कि बस हम इससे ज़्यादा काम नहीं कर सकते. They were there for everyone who was going beyond to be like, I need to stop, I need to break and help me out. Right? So we've all worked beyond those hours.
And having said all this, I would still say that it's easier said than done. So हम इतनी सारी बातें तो कर रहे हैं, but that
में से किसी का भी कोई अच्छा नहीं है work life balance, so very honestly.
And नहीं, उसके अलावा भी, I mean, we all have good days, we all have bad days.
Yes.
So I mean, because for the people
It's
who
just a thin line. There's no demarcation कि भाई ये है. Just like you all said.
Hamdan had mentioned it's a constant reminder, right? You have to keep telling yourself कि यार मैंने थोड़ा balance रखना, अपने लिए time निकालना है, family के निकालने, काम के लिए निकालना है. But you'll never, like, no one has aced this.
and you will always feel
And eventually as surgeons हम लोग कोई भी एक काम अगर मुसलसल करेंगे हम बोर हो जाएंगे. By nature हम लोग के अंदर ये चीज़ होती है, घर पे भी ज़्यादा रहेंगे तो हमारा खुद की फैमिली लाइफ हम लोग अच्छी नहीं लग रही होती. Because we understand कि the amount of intensity that you have to go through in your life, it has to be intense in everywhere. So you've got to just make it short bursts of good intense life at work and life personally.
I can continue for the rest of the day like this because मुझे मेरा तो पता है, because I like talking and stuff. एक सवाल last के what will be one message for all the surgery aspirants, neurosurgery, ENT, urology, general surgery out there who want to come into surgery? What will be your message for them?
So I think if someone asks me what is the single most important thing which is required for any specialty, so I would say that is passion. If someone has passion to be a surgeon, that passion will drive the aspirant to go in the right direction, seek guidance, work hard, do everything. Because if he or she is passionate to do it, they'll do it, no matter what. And one also has to be patient, because at times things which we want to acquire, they do not just come at the right time. At times it takes longer, and there is no harm, because people generally in Pakistan they say कि if मेरा एक साल पीछे हो गया मैं तो ये बहुत ही जो है आसमान ज़मीन पे आ गया है, बहुत मसला हो गया. It doesn't matter. Later on, 15-20 years later, it doesn't matter at all. No one asks कि आपने कितने अटेम्प्ट में FCPS Part 1 पास किया था, कितने अटेम्प्ट में Part 2 पास हुआ था. Everyone just sees कि इसको काम कितना आता है, ये कितना अच्छा सर्जन है. So being passionate and being patient. और ये थोड़ा मुश्किल होता है क्योंकि सर्जन जो है वो थोड़ा मुझे लगता है इनहेरेंटली इम्पेशेंट होता है. लेकिन इस फेज के अंदर यानी अपनी स्किल्स और एक्वायर करने में अगर थोड़ा सा देर लग रही है तो आपको परसिवरेंस शो करनी है. And you just have to stay committed, passionate, and then you'll achieve.
I think surgery is a lot of communication skills. आप उनसे सीखते हैं जिनसे आप अच्छा बात करते हैं. आप मरीज उस वक्त खुश होता है जब आप उससे अच्छा बात करते हैं. और अपनी you're in a lot of stress or a lot of the times. लेकिन controlling that stress while you're communicating with others, if you're not throwing it around, I think that is when you'll become part of teams automatically. People will start liking you. People will teach you stuff which they would not have taught somebody else. So, along with communication, is a little bit attention to detail. Attention to detail is what keeps us on top of our game. हर छोटी चीज़ मैटर करती है. कोई चीज़ हवा में नहीं होती. हर चीज़ के स्पेसिफिक रीजंस होते हैं और उस तक जानना, उसको करना, और उसी की कम्युनिकेशन जो है ना, whether it be your seniors, juniors, your colleagues, I think that takes you places where people will vouch for you to help you get there.
I think अब जो juniors हमारे पास आते हैं उसमें recurrently जो मैं एक issue अब देखती हूँ, many of them they don't have their basics very good. So one thing that I would say is get your basics sorted. That is very important, and that will definitely go very very long way. I mean that is not just for those doctors who want to be surgery residents, but then advice in general. And second most important thing is professionalism, because we all are dealing with it. We all are facing these things that the juniors that are coming to us now, they most of them they lack professionalism. So professional attitude matters, because at the end of the day, we all are here for, other than our career, other than for making money, we are into patient care. So professionalism for that particular thing really matters. So I would add these two things to the on-by list.
I mean, I think they've all, as always, summarized it all beautifully. They've everything that I was thinking throughout the way each one of them mentioned, so I'm not going to say much. I think they've given the gist. What we need to understand, most important, that we're in this field, we choose to be in this field, no one forced us into this field, and it's a service. Right? So, if there's money in our kismat ya naseeb, wo aayega, whatever we're going to do, that's all secondary. The most important part is for us to go out there, do the best job that we can with the best intentions for our patients. And I think for that you need to be professional, for that you need to be ethical, for that you need to know the science, you need to know the basics, you need to read alongside, for that you need the skill, and all the other qualities they have mentioned. I think Roshan pointed out a good point that being a good surgeon doesn't mean the one that comes and clinically calm karta hai. During residency, we tend to forget, and I had this problem myself, which is why I'm bringing it up. We tend to forget to read, because as long as you're getting the job done, no one will tell you, beta padho ya kuch karo, but eventually as time goes by and they come to senior years, the good versus the really good versus the excellent resident are those के काम तो सारे कर सकते हैं, but एक होता है जिसको knowledge भी होती है, since we बहुत research भी की होती है, you have to be good at all trades, you have to take all these things alongside and not just be like a residency as everything goes on board. I did those things and I was like, they're concentrating on one thing at a time, and that doesn't help, and with time I realized you have to take everything alongside. So I think, but most importantly, you need to love what you're doing, you need to have the passion for it, and you need to be in it for the right reason, then life kind of works out and things fall into place automatically.
Thank you everyone. Thank you, Dr. Shah, for having us. And hopefully we'll be doing this again some other day. Thank you.
Smile, no frown.
Yes, smile.
One message.